cluster headache has historically not been considered a genetic disorder compared to migraine. We all know people have relatives with migraine, and if you suffer from migraine. So I gave a talk on the recent progress on genetics and cluster headache. Already in the 90s, it was reported that monozygotic twins both had cluster headache, and between 2 up to 20% of all cluster headache patients worldwide report that they have a close relative with the disease. So in this presentation, I gave an overview on all the different genetic studies that have been done on cluster headache. And the genetic studies can be done in 3 different ways. You can either do linkage studies when you collect families with cluster headache. You have family members in several generations, both sick and healthy, and you try to identify a genetic marker or gene that is inherited with the disease. And then you can do candidate gene studies when you investigate genes that you think are involved in the pathophysiology of cluster headache and look for genetic markers in the genes, patients and controls. And then genome-wide association studies when you screen for genetic markers all over the genome on each chromosome and compare healthy individuals with cluster headache. And so 2 years ago, something was formed called the International Consortium for Cluster Headache Genetics. And this network was formed since 2 genome-wide association studies have been performed on cluster headache on European cohorts. One of the cohorts included patients from UK and Sweden, and the other contained cohorts from the Netherlands and Norway. And in both these genome-wide isolation studies, we found very strong linkage to 4 chromosomal loci, 1 on chromosome 1, 2 on chromosome 2, and 1 on chromosome 6. So yeah, that's a bit of a background on where we are now.